Hey, this is Jessica DaMassa with WTF Health. I am here with Jen Lannon. She is the Health Innovation Lead for dotHealth. I love my dotHealth website, WTF.health. Thank you. Oh my God, I was so excited when you guys retweeted it. I can't even tell you, so thank you. So I have a million questions about the dotHealth domain and what's going on. Okay, so what is the best dotHealth domain you've seen yet, other than mine?
Oh, I know. Shucks, that was going to be my answer. So one of my favorite recent ones, we'll do it by time because there's so many awesome ones that we've been working on.
Very diplomatic, Jen.
I know. So I love G4A.Health, which is Bayer's Grants for Apps program for their innovation stuff worldwide.
Yep.
And they just rebranded a few weeks ago to G4A.Health. So I love their team in general, love what they're doing. Love that they're coming to the US for stuff. And I love that my social media feed keeps getting filled with all of these G4A.Health mentions. So that's like my favorite one right now.
Eugene Burkowicz and his team out there are going to be really happy that they won that. Close second to mine though, right? All right, so what has been the craziest domain that you've seen?
I mean, WTF.Health is definitely crazy.
Did you guys take pause when you saw that come through? Like, wait a minute.
No, I mean, honestly, it's so funny because you were like, oh my gosh, is it okay? And I was like, no, it's awesome.
Thank you.
And that's like the great thing about this new domain world is that you can think of anything you want and you can do it. Why have a boring name? Like that's one of my other pet peeves in this whole domain world is like you can have any name you want. Like why would you do something boring? So I love that one.
All right, thank you.
Yeah.
So who is buying dotHealth domains? I'm really curious about this because I mean it's a whole new extension, right? And like, are you seeing providers get into this space, like actual like doctors' offices buying a dotHealth, or are you seeing just innovation folks? Like, who are you seeing buy these?
Yeah. So I work a ton in innovation, and when we kind of first launched, it was mostly innovation, mostly startups. And that's why you see me so much at all these conferences. We've got an amazing kind of awesome backlog of all of these startups that have rebranded or launched since, we just launched last year, and there's companies that have literally started on a dotHealth domain from scratch. So in terms of like first movers, as expected, those are kind of who we've seen kind of grasp it more quickly.
Yeah.
But we have actually seen hospitals and health systems rebrand to dotHealth.
That's cool.
Like multi-hospital systems using dotHealth as their primary presence for their domain. So that's really exciting. Obviously those ones didn't happen overnight. And so we've seen a few of those kind of start to happen. There's a lot more by health systems, by pharma, that have been bought. And it just takes them longer to do something with it.
Yeah. Is there anybody who's not buying a dotHealth domain that you're surprised about? Like, oh my gosh, this whole entire population of like professional associations dedicated to doctors are not moving over. Like, is there anybody you're surprised?
I mean, I don't want to call out anyone in particular.
Oh no, you're not like it's a bad thing.
I definitely have been surprised a little bit. Like some companies that you would think would be super protective of their brand and would kind of be aware about this, and we've definitely kind of touched them with all of the marketing and the things that we've done. A lot of times it's so reactionary, and the sad thing about domain names is like once it's gone, like it's pretty much gone. I mean, there are like, if you have a legitimate trademark, there are established ways that you can file a complaint and get it back. But it just seems to me like it's just so much easier to just buy it so that you have it. So I still recommend that to people, like especially if you're a big brand where you care about your brand and you don't want someone else to build on that. Like the simplest way to avoid that is to just buy it. And then hopefully you end up doing something awesome with it. If nothing else, you can just redirect the traffic from your .health to whatever your main site is. And, maybe start experimenting with other ways that you can use it. But that is my number one thing is like for brands that are big enough and they don't want someone to build something on the .health version, like just buy it and you can figure out what you want to do with it at some point. And we're happy to suggest things that you can do with it. But yeah, that's my advice.
Good advice. So we've asked everybody, WTF Health.
Yeah.
So what's the future? Because it's WTF, what's the future? So what's the future as far as the .health domain? What do you think is going to be coming down the pike here?
I think what we'd really like to see is, and again, in terms of like that cycle of like startups are first, we've seen health systems. What's taking the longest is like big brands, pharma and other just like billion-dollar corporations. So, I mean, actually Bayer is a great example of like, we're starting to see some of those start to experiment with .health domains. We'd really love to see more like consumer-facing, like patient websites. We've had a lot of those already, but they're more from like smaller pharma companies. And so that's like what we're excited about and we're really working on this year is getting more like really big brands to try something on a .health.
Got it. Well, we encourage everybody to sign up for one. It's a great extension to have, even though some of those, some people who are older in the space can't keep wanting to try to put a .com after the .health. Eventually that will go away, right, Jen?
Yeah, and the good thing is that, more and more we're all becoming digital natives. Like the older people that don't know how to use the internet are gradually retiring. So yes, and our founders actually founded another domain company before this, .co.
.co.
And so
You can't get your .com.
So yeah, obviously that wasn't how they marketed it, but in terms of, getting uptick, like they started that in 2009, and this most recent wave of like these new domain extensions wasn't until 2012 and later. So they were really at the early end, From how we see it, it's easy these days. It's so much easier. People actually, like AARP is advertising during the Grammys and .AARP, and Amazon is advertising in airports all across the world with .aws, build on .aws. Yeah. So like every time we see more and more of those use cases, regardless of whether it's on a .health or some other new domain extension, we're like, yes, okay, this is good. This is good for the space. Yeah.
Good. Well, Jen, it's a pleasure to talk to you. Thank you so much for joining me. I'm Jessica DaMassa with WTF Health. WTFHealth.com or WTF.Health, sorry.